Assalamu alaikum wa rahmatullahi ta'ala wa barakat, and welcome to our special program on kidney. And today we are looking at kidney health. And as usual, Mahdi TV promotes things to do with the health. That's why we have so many programs on health. And I'm very much privileged to welcome or invite Dr. Manoj Gumber. How are you?
I'm fine.
Hope your journey was smooth and nice. So just a brief of Dr. Manoj is that he's a senior consultant in nephrology and renal transplantation. And then he has treated over 25,000 patients to date. And he has 20 years experience. And then he's been talking, or he has been invited in various renal nephrology conferences as a guest speaker. And he has published over 40 papers on this topic in various journals and books, international repute. So currently he's in Apollo Hospitals at
Ahmedabad.
Yeah, that is in India.
That is in India.
Okay. So that's the brief about Dr. Manoj. And today we have him, and we'll hear more and see more about kidney health. So just also to give a brief of how the status of kidney in the world, and especially in Kenya, is that according to the World Kidney Day website, we have about 850 million people, that's patients, kidney patients. This is a big number, almost a billion. And in Kenya, we have close to 4 million, that is 10% of our population. And again, the one shocking thing that I saw is that 2.4 million people die annually because of kidney health. I don't know whether I'm right in those statistics, but that's what I found in, when I was researching these things. So it's, in Kenya, it's said that kidney diseases are at alarming rate. And the government rolled out this program on a dialysis machine in all counties, 47 counties. Currently, we have about 74 kidney units, kidney dialysis units across all the counties. So that's just a brief of what the status of kidney health in Kenya. So Dr. Manoj, maybe we can start by just explaining what these kidney diseases are. Maybe if you can just...
Kidney diseases are of two types basically. One is acute kidney injury and the other is chronic kidney diseases. Acute kidney injury occurs because of infection or because of severe loss of fluids in the body because of vomiting, diarrhea, or for any other reason. Acute kidney injuries are recoverable with or without dialysis. While in case of chronic kidney diseases, they are irrecoverable. That means any person who has chronic kidney disease stage 3 ultimately will end up in ESRD, that is end-stage renal disease.
What's that?
That means your 100% your kidneys are not working now. At this stage, you have to think about the possible treatments. Without treatment, patient will not survive too long. These treatments are either in the form of dialysis or renal transplant.
And just paint a picture. What are these kidneys, these organs do in our body? Do they have some functions?
Yeah, they are actually very important part of our body. Usually people think that it's just they filter the blood, they remove the waste products and make urine. Yes, it is one of the major functions of the kidney. But others are maintaining fluid balance, maintaining electrolyte balance, calcium, phosphorus, sodium, potassium, making the bones healthy by producing active vitamin D. They are actually responsible for your production of hemoglobin by producing erythropoietin. They actually control the blood pressure. In overall, it is a myth that actually that heart controls the blood pressure. No. It is actually the kidneys control the blood pressure. So practically these are all the functions of kidneys.
Wow. So, like, what are the early signs and symptoms that I might know when, so that I know maybe there is a signs of kidney?
Well, there are no early signs or symptoms of kidney failure. By the time you actually develop some symptoms of kidney failure, practically or 90 to 95% of the kidneys are damaged. So that is the reason no person can know his or her kidneys are not working properly unless and until he goes to a lab and gets some tests done, which are very economically done in all over the world. There are only two basic tests if you do it, okay? Just the creatinine and the urine RM. Then probably you can detect it early. Otherwise, if you wait for the symptoms, 90% of the kidneys are damaged when the symptoms appear.
And what are the main causes of this kidney failure?
The main causes of kidney failure are hypertension, diabetes.
That's high blood pressure.
High blood pressure,
No.
diabetes, renal stone disease, chronic glomerulonephritis. There are others too, like some genetic disorders, the collagen vascular disorders like SLE. These are the causes, but principally you can say three. Diabetes,
diabetes,
blood pressure,
and
renal stone disease.
Okay. So, because diabetes, we talk of it's kind of a lifestyle disease. There is this saying that says, we are what we eat. Is it true to kidney?
Actually, it's practically the proverb is for all, actually, from top to bottom. Obviously, what we eat is very, very important, because nowadays obesity has become one of the reasons for kidney failure, not directly but indirectly, because obesity leads to hypertension, obesity leads to your diabetes, and these are the principal causes of kidney failure. So if you want to prevent chronic kidney failure, do not allow diabetes and hypertension to enter into your body.
So,
and these can be prevented by proper lifestyle and eating habits.
So proper lifestyle, you mean like how being fit or something?
Proper lifestyle means you walk daily, you exercise daily, you maintain an optimal body weight, do not eat too much artificial sugars. That is a very, very important thing actually. And do not use too much of mobile. Because mobile phones have become one of the reasons for obesity in childhood. Because nowadays, I do not know what about in Kenya, okay, in India, the kids are hardly seen on the roads or the gardens playing outdoor games. They are basically happy with video games and mobiles, and this leads to obesity, because you cannot have a sedentary lifestyle in childhood. Because if you are obese in childhood, there are good number of chances, okay, that you will be obese in your adulthood. So you have to start.
The same in Kenya. The kids nowadays, you can't find them swimming like here.
Yes, exactly.
Yes, yeah.
That is what I am telling, okay. It's not the mobiles cause the kidney failure, no. But sticking on the mobile for hours and hours, okay, and not exercising, not going out to play with your friends, with your brothers, sisters, and that is the cause for obesity in childhood, and this leads to number of problems in adulthood, and that is the reason I am telling you, okay. It's lifestyle, but it's our duty as an adult actually. My kids may not listen to me, okay, but they follow me. If I do exercise, if I eat and live healthy lifestyle, it is very easy for my kid to say, no, you are supposed to live like this, or even if you don't tell him, probably he'll follow you. But if you yourself are on mobile and video games for a good number of hours, then you don't have the right actually to tell your kids, okay, please do not be on mobile.
There is a podcast, something like a podcast. I was listening at your speech, and you are talking about maintaining good relations with your parents. It kind of prevents kidney. How does that one?
It's all about stress actually, okay. Stress is one of the factors for hypertension and diabetes, okay. Nowadays what happens is that the concept of nuclear families are there, okay. And probably if a brother is having some problem, he may not have, they are not very keen to share with others actually. They keep it to themselves and that leads to stress. A family is very, very important in upbringing of the kids. That bonding has to be very much there amongst the brothers and sisters. So that if you are in stress, you can just speak out so that your stress level goes down and these deadly things actually, the blood pressures, the diabetes, they don't creep in. There is a famous proverb, I should say, that if you fall in love, the heart breaks. If not, the bones break. If these two do not break, then your bank balance break. But if you let if you let diabetes and hypertension fall in you, practically your heart breaks, your kidney breaks, and your bank balance also goes.
Wow. Yeah, because you have to pay for the...
Yes, exactly.
Exactly.
Imagine prevention of kidney disease, how much it cost?
Maybe zero.
Maybe zero, yes,
Because
exactly. Because you have just to walk and keep yourself healthy. What does it cost each dialysis session?
Here in Kenya, I was checking, that's 2017. It was saying like
$100
per
session.
Yeah.
You're supposed to go twice or thrice in a week.
Yeah.
So practically how much you're spending. And kidney diseases are deadly because supposedly you get a myocardial infarction and then there is a stenosis in your coronary arteries. What it requires is placing a stent which is available in the market. But if you develop chronic kidney failure and you are on dialysis, there is nothing available in the market which can replace this. Only thing is that you have to ask for an organ from somebody. It's not easy. So you can imagine, okay, if your kidney has a problem, then who is the person going to help you out? It's very difficult actually. So you have to, there is no option actually available for all of us to prevent. We cannot chase this disease. We can only prevent it. Maybe I took around 40 years to understand this, okay, that prevention is better than cure. Maybe I learned this proverb in my childhood days, but at that time maybe just I was just memorizing it, okay, but never understood it, okay. Yeah, but now, yes, I realize all the proverbs taught to us in childhood, okay, they are very, very relevant, okay, which I remember is health is wealth, prevention is better than cure, a healthy body has a healthy mind. Because ultimately what we all of us look for, peace of mind.
Yeah, exactly.
Ultimately. But if your body is not healthy, how are you going to achieve your peace of mind? Because peace of mind comes when helping others. If you help somebody, then you are at peace, okay. But you can help others only when you are healthy actually. When you are able to do it. So basically, the systems are one. It's not that heart is different, the kidneys are different. Practically, if you prevent your kidney is okay from any diseases, you are indirectly preventing or directly preventing your heart diseases. It's not that walk exercises will only protect your kidneys. No, they'll protect your heart too. Practically all the non-communicable diseases can be preventable. And it is our duty actually. The God has given such a beautiful creation, okay, as a body. it's our duty to maintain it. You cannot spoil the body while to smoke, to drink alcohol and only alcohol, okay? You cannot spoil the body. God has made a creation, okay? Such a wonderful creation, I should say. So it's our duty to take care of this body. Okay?
And then the other thing is when someone is in chronic kidney failure, what are the options in treatment?
Well, there are 4 options available. Once the stage of ESRD has reached, to survive, there are 4 options. Actually, there are 3 options. People choose the 4th one, not doing anything actually.
The 4th one is not
doing anything actually.
You just let yourself die.
Just let yourself die.
Wow.
But that is not an option. So you have peritoneal dialysis, you have hemodialysis, and you have renal transplant.
So those are jargons.
Hemodialysis is that you have to go to the hospital, your blood is being taken out, run through a filter, all the things which kidney does practically. But dialysis is not able to do 10% of what kidneys does. Even if you do thrice a week dialysis. So practically, it is just that you can remain alive. And it is costly. Just you told, okay. So the other option is peritoneal dialysis. Peritoneal dialysis is home dialysis. Okay, you insert a catheter into your peritoneum, that is your, in a layman's language, abdomen, and you can do your dialysis at home.
So how is that done? Or you have a machine?
No, it's not having a machine. There are 2 types of that also. I'll not go into the details of that, okay. Yeah. You have to make your abdomen fill with your fluid, okay. There is a special kind of fluid which is called peritoneal fluid, okay. You fill it, place it inside for 4 hours, remove it. You do it, these kind of cycles, you do 4 in a day, and you be at home. But it is still costlier. Almost like 1.5 times to 2 times that of hemodialysis.
Oh, it's much more costly than
hemodialysis, yeah.
Hemodialysis in hospitals.
In hospital.
Okay. The only thing is that you're at home,
you are at home, maybe a little bit of fluids are allowed in this. Maybe the diet restrictions are less. You are not exposed to hepatitis B and hepatitis C. And practically you are little bit more independent than on hemodialysis. But obviously the final cure, these are not the cure. These are just to continue to be alive.
Lifesavers, kind of.
Yeah, it's not cure. Cure is only renal transplantation.
Renal transplant?
Renal transplantation
means that kidney?
Your family members have to donate a kidney. You have 2 kidneys in your body. And the kidneys work 9 to 10 times than actually it is required. So, taking 1 kidney from a family member will not affect his life, but it will give life to the patient. But I know it's difficult, but this is the only cure available for chronic kidney failure.
So that's that's the cure and the best cure, that kidney transplant.
Yeah, kidney transplant is the cure for chronic kidney failure who have reached to a stage of ESRD.
ESRD, that's what?
End stage renal disease,
renal disease.
Or stage 5 disease.
So, like here in Kenya, according to just recent statistics, is that we don't have a legislation for a law for kidney or organ donation. So sometimes it's very difficult when you're working in that. I don't know how it is, maybe in your place.
No, we entertain only family members for donation. It's not that a friend or a relative, distant relative is not going to be the donor.
And
it's only close relatives, brother, sister, mother, father,
okay.
son, daughter, wife. These are the relations which are we accept, and in general all over the world accepts as a for organ donation. But the next is, okay, well, I'll see, okay, the next, the Kenya and all of the world should look for brain dead organs from brain dead persons. That is cadaveric renal transplantation. We should encourage cadaveric renal transplantation. That means we usually know that person dies when his heart stops. But there is another kind of death actually. In case of road traffic accidents, in case of hemorrhages, intracerebral hemorrhages, the brain stops functioning, but the heart is beating, the organs are perfusing. This state does not last long, okay? Maybe for a person it may be 1 hour, it may be 2 days, it may be 5 days, but definitely a person who has been declared brain dead ultimately will have a cardiac death. That means his heart is going to stop. Between this period, okay, you can take the organs, which can be used for others who are suffering, who do not have donors, and who cannot afford $100 for each session. And the problem is that you spend $10,000, $12,000 a month. That is almost like, and you have to continue spending from January to December, and you want to see another December, same you have to spend amount, and your health deteriorates. Probably you may or may not be able to continue your responsibilities, your job. Practically you become jobless, and there is a tremendous pressure, financial burden on you. So ultimately I'll say that you cannot chase this disease, prevent it, and if somebody develops it, go and do renal transplantation.
So this renal transplant, sometimes it has its own, some disadvantages maybe, because we understand maybe when you are doing this blood transfusion, there's some blood that cannot like...
They should be ABO compatible, okay?
Okay.
Just like a person from O can receive kidney from O, okay? A person from A can receive from A or O.
Okay.
B can receive from B or O, and AB can receive from all.
Okay, okay. So
here
it's just like the way blood...
The blood is, but here the RH factor, the plus minus, okay, O negative, O positive, does not come into picture.
Or the rhesus factor doesn't come to...
Yeah.
Okay.
It doesn't come into... O negative can receive from O positive.
NaO, that is negative?
Yeah, okay, that is okay.
Wow, that's good.
But obviously, every therapy has its own advantages and disadvantages. But if you see the risk-benefit ratio, then definitely renal transplant scores much higher than hemodialysis and peritoneal dialysis.
There is a case that was just highlighted the other day on 14th March, when we were observing the World Kidney Day, and there was a lady appeared in one of the stations, and she's surviving with 3 kidneys. How is that possible?
It's surviving with 3 kidneys means is 2 kidneys must have failed. Usually what we never remove, usually, the old kidneys. The existing ones, which are natural ones, are to be placed there only. And the new one is placed at another place. Okay, it's placed in the front of the abdomen. Okay, so it's surviving with 3 kidneys. It's only functioning will be only 1 with that female. Okay, the 2 which are not functioning, they are kept as it is. They are not removed from the body.
Wow. And the other interesting thing is that they were saying the 3rd kidney was failing, so there is a likelihood of...
Likelihood of 4th transplant, 3rd transplantation. This occurs actually, okay, but there are a lot many factors, okay. If the patient stops taking drugs, yes, your kidneys are going to fail, okay. If you are not taking care, okay, after renal transplantation, if you are diabetic and if you don't control your diabetes, Diabetes will eat up your new kidney also. If you are having blood pressure and you are not controlling blood pressure, then again, it is going to affect your new kidney, definitely. So the rules and regulations are practically the same. Even after getting in transplantation, you have to live a good, healthy lifestyle. There is no choice actually, whether before the kidneys fail or after the kidneys fail actually. It's your choice, okay, to choose whether the prevention is better than cure or you have to suffer and then you realize this, okay.
Wow. Because I think that is the main maybe misconception. Because personally, I thought when you've done kidney transplant, then you can just live the way you want. So everything has to be like...
It has to be, even for a normal person, even for a person like you and me, okay.
Yeah.
Healthy lifestyle is must actually. If I don't take care of my kidneys right now, my kidneys are not going to take care of me after 20 years, 25 years, definitely.
Wow.
It's same with every organ, okay.
And then maybe just coming to winding up, what is the advice that maybe you can give to the world, and especially Kenyans, because we are in Kenya?
First of all, wake up, walk, exercise. Do not allow hypertension and diabetes to creep into your body.
Okay.
Eat healthy food. Do not eat pizzas, pastas, and these aerated drinks. Maintain your optimal body weight. Do not take over-the-counter painkillers.
Okay.
No. And stay hydrated. If your kidneys are normal, you should drink at least 2.5 to 3.5 liters of fluid per day to avoid the development of kidney stones. And stay healthy.
Okay. Are there maybe just a question? Are there maybe kind of, beside maybe the conventional medicine, are there maybe herbal way of doing
No,
this?
actually herbal medicines are rich in metals. Once your kidneys are damaged, then the power to excrete these metals is no longer as efficient as when your kidneys were absolutely normal. So, in a failing kidney, these metals accumulate in the body. And once they accumulate, they further deteriorate the kidneys and they deteriorate the whole body. So, herbal medication should not be taken for kidney ailment.
Wow. Thank you so much. I think this has been a very educative program. And I think our viewers also have learned something about kidney health. And
if you have any queries, you can always ask us, and you will be given the numbers and the email IDs at the end of the program. You can very well hang on to this. We'll definitely respond to that. Thank you.
Thank you. So we'll take a break and then we'll come and interview or have a chat with someone else who is also going to tell us more about your work. Because I think I've been told that you've been in Nigeria. It's like you're traveling all over.
No, it's just actually I had, since 2013 actually, I'm coming to Nigeria on the World Kidney Day. Every year I am there just to spread awareness of kidney problems and discuss the solutions. It's more of a preventive aspect because I believe prevention is the only answer to this problem.
Great job. Thanks.
Thank you.
Thank you. So we are coming back in a few seconds.